Welcome back to Dr. Moses Medical Channel. Are you over 50 years old? Do you wonder why certain medications cause a lot of side effects? If you are over 50 years old, then this video is for you. Let's dive into it. There are a group of medications that you should be careful if you are over 50 years and above. Why is that so? Because as people age, their renal function decreases, so is the liver function. These two organs help clear all toxic substances from our body. So as people get older and the renal function and the liver function decreases, there is a tendency for medications to cause a lot of side effects. And these are common over-the-counter medications that people take. And so you should pay close attention to these medications, and if you have to take them, the warnings that you should take. The first one is NSAIDs. These are a group of anti-inflammatory medications like ibuprofen, Advil, naproxen, diclofenac. People take this medication for pain, but the biggest side effect of this medication that I've seen in my practice is GI bleeds, bleeding in your stomach. It can cause a new ulcer. They can also cause kidney failure. In fact, I've seen patients be admitted to the ICU who has had kidney failure because they were taking ibuprofen, which was prescribed by their physicians. Now, I'm not saying you should not take these medications. If you have to take them on a short-term basis, that is fine. Actually, a week is fine. But even that, you should drink a lot of water if you're taking these medications. And you should not take them on empty stomach. Now, if you are taking it beyond 2 weeks, you should be very careful and you should check your kidney function. And if your physician prescribed this medicine for you for a long term, take it for a month, 2 months, you should not do that because you stand the risk of having a bleed and the worst, having a kidney failure. So be very careful with the NSAID, especially if you're over 50 years and above. The second group of medication, which also we see a lot of people take over the counter, is Tylenol or acetaminophen. Now, acetaminophen can be taken up to 4 grams a day if you have a normal liver function. Now, if you drink alcohol or you have abnormal liver function, then you should be very careful with Tylenol. I've seen many people, in fact, about a month ago, we had a patient who was just taking Tylenol for back pain. And she took so much Tylenol that she started getting concerned about it. Her pain was not going away. She came into the ER for pain that was not going away because she was taking Tylenol. And guess what we found? Her Tylenol level was so high that her liver function was impaired. She has to be admitted and placed on medication to clean out the Tylenol toxicity in her body. She was very lucky she came on time, so she didn't have to get a liver failure. So it's very important if you're taking Tylenol that you do not exceed 4 grams in 24 hours. The next group of medications that you got to be very careful when you're taking is aspirin, even baby aspirin. In fact, have you heard, did you go to the doctor's office, you were 40 years old, and they told you to take baby aspirin because it's going to prevent heart attack and even stroke? Well, it used to be that, but it's no longer true. There is an article in the JAMA, the journal of the JAMA is one of the medical journals, and I'm going to leave a link in this video. Now, this article shows that if you are a patient 60 years and above, and you don't have a risk factor for heart disease or for stroke, or you've never had a stroke before, taking aspirin a day to prevent your first heart attack or a stroke is no longer recommended. In fact, the U.S. Preventative Service Task Force actually says this, and I quote, "The adults 60 years and older should not start taking aspirin to lower their risk of the first heart attack or stroke." And this is an article that was written in 2022 in the JAMA, and I'll leave it in this video. So do not take aspirin if you don't have a risk factor for developing a heart attack or a stroke. Now, the next group of medication that I see people take over the counter, especially the elderly, is Benadryl. And this you can find in Tylenol PM or Advil PM. Now, what this does, especially to the elderly, is that it can cause a lot of drowsiness, and they have a fall, and they break their bones, their hips, and they have a lot of complication, and end up sometimes losing their life. Now, these will also decrease memory in the elderly. So if you have to take an antihistamine, I recommend you take the class 2 antihistamine, which is Claritin or Allegra. They don't have the drowsiness effect or the anticholinergic effect that these other medications do. Benadryl does. So be careful if you have to take Benadryl for sleep. That can also cause drowsiness. Okay. The next group of medication is Sudafed or pseudoephedrine. Sudafed is really easily taken for cold symptoms. Some people have a cold, they rush to the pharmacy, they pick up Sudafed. Now, the risk of using Sudafed is that it can increase your blood pressure. It can spike your blood pressure if you're using Sudafed. And also, if you combine Sudafed with NSAIDs like ibuprofen, it increases your risk of stroke. So be very careful if you have to take this medicine, especially if you are 50 years and above. Now, older men who has prostate problem, who has what we call BPH or benign prostatic hypertrophy or hyperplasia, that have urinary symptoms, by taking Sudafed, you run the risk of having urinary retention and you end up going to the emergency department. So be very careful if you have to take Sudafed for a nasal congestion and you're 50 years old. Know that these complications can happen with this medication. Now, the next group of medications are intranasal steroids. Intranasal steroids like Flonase. People usually go again over the counter. They take it. They have, decongestion. They have it or allergies. They use these medications a lot. Now, the studies have shown that these medications can increase your eye pressure and cause glaucoma. So you be very, very careful if you have to take this medication. You have to take it for a short term, probably that is okay. But if you're on it chronically, then you need to make sure you go to your eye doctor and get your eye pressure checked. They can also increase the risk of nosebleed. So if you're somebody who easily bleed in your nose, then these intranasal steroids can increase your risk of bleeding in your nose. The next group of medication, which is very, very common, people take these days, is the proton pump inhibitors like Prilosec, omeprazole is also called that, or Nexium, and the other one is lansoprazole or Prevacid. These group of medication we call PPIs or proton pump inhibitors. People use them to reduce their acid reflux, and it's over the counter these days. You can just go and buy them. But the risk is that they'll reduce your stomach acid if you take it for a long period of time, and reduces your absorption of calcium. And what happens if your absorption of calcium is reduced? Your bone becomes fragile and you stand a high risk of getting fractures very, very quickly. So if you should have to be on a PPI or a proton inhibitor for heartburn, don't be on it for more than 2 weeks, 2 to 4 weeks. Because if you have to be on it, and I recommend you change it to a Pepcid or something like that, but don't be on a PPI for a very long time because your risk of fracture is increased. Now, there's also another risk when you are taking this. Because you take it for a long time, it can cause a colon infection called C. diff colitis. It's a very, very serious colon infection. And also, another big one with the PPIs is that it can cause pneumonia, especially in the elderly. And we have seen a lot of elderly people who comes in taking PPIs or proton pump inhibitors, and they get aspiration, they get a pneumonia. So it's very, very important that if you have to take this medication, don't be on them for a long period of time, because these medications can be very detrimental to your health. Now, the last but not the least is magnesium citrate or milk of magnesia. People who have constipation, they go to over the counter and pick up this medication. By the way, if you have not listened to my video on the natural remedy for constipation, you should watch that video. It's up here. Because when people have constipation, they take these medications, and what happens is that it causes a lot of electrolyte abnormalities like low calcium, sodium abnormalities, and this can be very, very dangerous to your heart. So these are some medications that if you're 50 years old, you should be very, very careful taking them. So again, this is the end of my video today. And if you have been very helpful with this information, I want you to subscribe to my channel. Don't forget to give us a like And we'll see you on another video next week to bring you some information about your health. Remember, you are your own doctor. You have to pay attention to your health. No doctor will, because doctors are trained to prescribe medications, but you are the one who can take care of your health. So I hope this has been helpful to you. Until then, you stay well.